Hi there, my name is Graham Codrington, and here is your latest COVID update for South Africa, and we're in the middle of May 2021. I am not a doctor, I'm not an epidemiologist, I am a scenario planner, a strategy consultant, a futurist, if you like, working with a company called TomorrowToday Global. We look at disruptive change and we help our clients to anticipate the future and disruption. And obviously for the last year, we've been focused quite a lot on the impact of COVID, lockdown, and what's the biggest disruption we're facing in the world at the moment. Our clients who have listened to us over the past year, and we've worked with lots of clients around the world, they've done fairly well, actually. Some of them have had their best year ever because looking at scenarios, looking at the possibilities for the months that lie ahead, give you the opportunity to make informed decisions. So that's what we do. And over the last few weeks, I've had a number of questions coming from clients, and I've seen lots of information and misinformation, to be honest, floating around. So I thought I'd answer a few questions that have come our way and just clear up a few things here in May 2021 as we look especially at the South African environment and the COVID environment. Now, of course, probably the biggest news that's facing us at the moment is that we have begun our third wave. I think at the moment it's pretty inevitable that we are going to see a third wave of COVID. And here's the graph. Except this graph is not the graph of COVID. This graph is 100 years old. It's actually the graph of the deaths from the Spanish flu in 1918, 1919. And you'll see a first wave, a much bigger second wave, and then a third wave. It's also the graph of the Singapore flu of 1957, the Hong Kong flu of 1968, of SARS, of MERS. In fact, pretty much all the global pandemics we've faced in the last 100 years follow a very similar pattern. You can do a YouTube search for a video I did about a year ago exactly this time, where I put this graph up for the first time and said, buckle up, we've got 2 years to go and there's going to be 3 waves. Here we are. Now, you'll see that the third wave is a lot smaller. Typically, what has happened in the last 100 years, every time we've had one of these pandemics, is we have the first wave, we panic, and we should do. We respond, we then sort of get over it. People get complacent. Bang, they get hit with the second wave, but now it's a lot more, virulent through society. And then what happens is the third wave typically is driven by variants and mutations. So new forms of the virus either infecting more people who thought they were safe or reinfecting people from the first wave. Now, we're not going to see as bad a third wave around the world at the moment, partly because epidemiologists know these graphs and are kind of trying to help us with that, and mainly actually because for the first time in human history, we have been able to develop vaccines to deal with the third wave. The problem is that we are now in a race between the variants or the mutations or whatever language you prefer, these new versions of a coronavirus. We're in a race between those developing and then trying to get the vaccines into everybody that's willing to take a vaccine so that we can stop the virus. Every time the virus moves to a new person, it has the potential to mutate and change. In fact, I think my understanding is every time it moves to a new person, it does change. And, 1 in a million changes is significant and increases the strength of the virus. Hopefully not beyond our vaccines, but that's where we are at the moment. The 3 variants we've been worried about for the last few months, since about November last year, have been labeled the Kent variant for the UK, Brazil, and sadly the South African variant. I say sadly because the South African variant didn't start in South Africa. It's not only in South Africa. It's been found in other parts of the world, and it's very similar to the UK and Brazil variants. It was just discovered in South Africa because we've got one of the best epidemiology setups in the world. That's probably, sadly, because of HIV and TB and other diseases that we've been dealing with for years and years. But we have some of the best virus doctors, epidemiologists, virology clinics in the world. That's why almost all of the vaccine manufacturers did clinical trials in South Africa, because they know that we've got the setup to do it and to manage it and to handle it. So we discovered this new variant before anybody else did, and they gave us the name. But it sounds a little bit scary that there's this South African variant, and so everybody says, well, let's not go to South Africa because they've got a variant. Whereas it's a global variant. And now, of course, India has got their own new variant, and they are in the midst of a very scary third wave. You see, the third wave does get scary, even with vaccines and an understanding of it, if your medical system gets overwhelmed. And so we're back to about a year ago with the same messaging we had a year ago. Flatten the curve, make sure we don't get as many people into hospital as India are seeing, because then hospitals get overwhelmed, you run out of oxygen, and you run out of ways to care for people. And then literally, sadly, as we see in India, dead bodies literally pile up in the streets. So what do we do in South Africa? And one of the questions that comes our way is, why are we not vaccinating more people? In fact, I think as of today, when I'm recording this, Zimbabwe has vaccinated more people than South Africa has. Part of that is because Zimbabwe has got the Chinese vaccines and are using them. And again, well done to China for donating some of their vaccines to Africa. China's been able to vaccinate their entire population, and they are now gifting vaccine doses to Africa. A year ago, China gifted millions of units of PPE, the personal protection equipment that we needed, gowns and masks and things like that. And this is part of China's strategy to build relationships with Africa. China's long-term strategy is to make sure that Africa becomes a source of commodities, even food for their people. And we've got to negotiate carefully with the Chinese, make sure they pay us the right amount for the stuff they want to take from our continent. It's not colonialization, it's business. And if we pay them, if they pay us for the things they take from us, we'll all be happy, right? And so this is part of relationship building, and well done to China, except there's question marks over the efficacy of the Chinese vaccine in Africa. Seychelles gives us that story at the moment. Seychelles obviously is a very small island nation, just 100,000 or so people. They wanted to open up again for tourism as soon as possible, their main industry. So they pretty much vaccinated everybody. They managed to procure vaccines, the Chinese vaccine via the Middle East as it happens, but anyway, and they vaccinated pretty much everybody who was willing and sort of convinced everybody. And now they're dealing with a COVID outbreak, a third wave of their own. And they are the most vaccinated nation in the world. And as of last week, they were also the nation that had the most active COVID cases per population unit. Yes, even more than India. And so there's question marks. We're not quite sure why that's happening, but we think it's because some of the COVID vaccines from China are not quite meeting the mark, or maybe they weren't given in time. I think the jury is still out. But in South Africa, we knew that the AstraZeneca vaccine was not going to be as effective against the variant we've got, the so-called South African variant. So we did manage to, that was the first batch that we got, and we decided not to use it. I mean, it's no good giving somebody a vaccine you're not really sure is going to work. So we gifted that to our neighbors further up into Africa who don't have the South African variant. Since then, the real issue is this. I'm seeing a lot of South Africans whining about the government. It is a national sport, isn't it, to whine about our government. And in a lot of occasions, there's reason to do it. But in this case, our government has got every single vaccine dose that they've been able to get. And let's talk about that for a second. There's a thing called vaccine nationalism. The rich countries of the world have hoarded the vaccine. They might use different language because they might say, well, we put a lot of money into the companies that develop the vaccine, so it's only right that we get the first deliveries of those vaccines. But for example, Canada has ordered 10 times more of the vaccine that they need for their entire population from different countries, from different companies. And it's kind of me first. We'll vaccinate everybody first. Now, Canada has said that once they've vaccinated everybody, they will give the rest of the vaccines for free to third world countries. Well, thank you very much. And yeah, I suppose that's better than not doing that, but still, we're rich, so we'll go to the front of the line. Thank you very much. And yes, I'm looking at you, UK. Yes, I'm looking at you, America. Yes, Canada. Yes, EU. In fact, even worse, AstraZeneca, for instance, was trying to charge African countries double the amount for the vaccines than they were charging the EU. It's just ridiculous. If you look into some of this, it's capitalism gone mad, and it's horrific. The pharma industry is not doing themselves any favors, I think, at the moment. So a lot of South Africans are saying, why haven't we got more vaccines? Well, the government is trying to get as many as they can. Some South Africans saying, well, 500 billion rand for vaccines was stolen. No, it wasn't. I'm not going to say more about that. Do your research, sheeple. Yeah, that's what the conspiracy theorists tell us. I'm telling you now, that money was not stolen. It is there. It is available. Some people are saying, well, why isn't private enterprise getting involved? Just go bypass the governments. You are legally not allowed to do that. There is international legal requirements on how pandemics are dealt with. And private companies may not get involved for precisely this reason. If we're complaining about rich countries jumping the queue, well, then we don't want rich South Africans, because they've got private medical aid, jumping the queue internally. Everybody should get a vaccine and should get equal access to the vaccine. And the South African government has said they will give everybody in South Africa free doses of the vaccine. And they've got the money to do it, and private business is involved. Adrian Gore, the CEO founder of Discovery, is head of South Africa's vaccine procurement team. And he's joined by Professor Mardi from Wits, who was in charge of the Oxford AstraZeneca trials here in South Africa. Professor Karim is involved. And there's lots of other people involved as well. I won't list all the people that I know, and there's lots more people I don't. But private business is getting involved. The government is doing the best that they can. Every single vaccine we have been able to get, we have got. It has arrived. Every single vaccine that has arrived has been put into somebody's arm already. As of the 15th of May, every single healthcare worker in South Africa that wanted to be vaccinated has been vaccinated. That process is finished. And from the middle of May, from I think about the 20th of May, we should be getting 150,000 doses a week. And now we will start rolling out to the general public. That number doubles to about 300,000 doses per week in June. And I think it doubles again in July. The goal is to have 4 million people vaccinated by the end of July. And there's no reason for us not to do it. Private companies are getting involved. And you can register for your vaccine on the government website. And when you do so, you will see lists of thousands of pharmacies and hospitals and locations where you can go to get your vaccine. Private companies are coming forward. Checkers ShopRite, for example, has said, we will vaccinate all of our staff and their families. And I know many other clients, some clients of mine and many other companies who are saying the same thing. This is going to work. But we can't give people vaccines we don't have, and we can't magically make the vaccines arrive when rich countries have pushed in ahead of us on the queue. This has got nothing to do with our government's competencies and abilities. So we are looking ahead at the next few months. So we've got a third wave coming that we hopefully need to flatten the curve on. We've got vaccines rolling out, but unfortunately, we are still on the no-fly list. That's the red list in the UK. That's level 4 from the CDC in the USA, which is the don't travel there list. And because of that, travel companies won't give flights. Airlines won't even fly here. Insurance won't cover. So people are not going to come. And we're not really allowed to travel. It's very hard to travel internationally at the moment. By the way, I mean, about what? 150 countries are on that list. So it's not as if we've been singled out, although it feels that way. And we're a distant country from Northern Hemisphere. So, it's always difficult to travel. It's now even more difficult. I think it's going to pretty much be like that until September. I think we're going to go through June, July with ramping up our vaccination program and seeing the third wave. Hopefully we deal with the third wave, and kind of that's partly up to us, right? Wear your masks in public, minimize your contact with people. We know how to do this. Let's not wait for the government to push us back to level 2 or level 3 or level 4. I don't think the government wants to do that. I don't think they will do that, but we've got to act that way so that they don't. I was just seeing too many Mother's Day pictures on Facebook with nobody with masks on. I go to the shops to do my essential shopping, and there's just people wandering around, not really actually shopping, just having an outing. We can't do that, people. We've been through a year of this. We know what we have to do. Sanitizing, wearing masks, limiting contact. We've got to do that for May and June at least to flatten that third curve. And then I think the world will watch us, and I think they'll see our vaccine rollout happening. I hope we can get the vaccines we've been promised. And even start manufacturing some generics here. I hope we'll be given permission in the next month or two to do generic versions, which will really help us. And I think then sort of come end of August into September, as we get out of winter and things start warming up, as we look towards the last quarter, I hope that we are reevaluated from a global perspective, especially for the tourism and travel industries. We want a December holiday season. People are desperate to travel, and we've got to make South Africa a destination they are desperate to want to come to for our summer Christmas holidays. And of course, for those of us who'd like to travel outward, we'd like that to happen. But it's not going to happen before the end of August or September. And if things don't go according to plan, it could be longer than that. Just one final point to make. You don't want to get COVID. If you haven't had COVID yet, you don't want to get it. If you have had it, you don't want to get it again, because you don't know how long your antibodies last, and you don't know if a new variant will infect you. So we've got to all act and live, even by the way, if you've had the vaccine, as if we could get it, because of this thing called long COVID. Less than 1% of people will die of COVID. So we've done brilliantly well to bring down the mortality rate. But about 20% of people who have COVID will have a lifelong impact. That's what we think at the moment. It's called long COVID. Do some research on it if you haven't heard of it before. But COVID is not a lung disease. It picks an organ in your body and attacks that. It's not a medical term, but that's a good enough summary. Picks an organ, whether it's your brain or your spine or your kidneys or your pancreas or your lungs. It picks an organ and attacks it. And 20% of people are going to have lifelong impacts because of that. This is a dastardly disease, and you do not want to get it. I don't want to get it. So where are we? Are we still on the down curve towards a deep hole at the bottom, or are we starting to see the light on the other side? I think there's still a little bit down to go. I think that COVID is still hitting hard, and I think we've got to still hang in there for a few more months. But we're beginning to see what the green curve might look like. Globally, countries that are vaccinating, America, Canada, the UK, Israel, others, They're seeing massive and immediate upticks in their economy, people being hired back into jobs. Industries rebounding, and there's no reason for tourism to rebound. It's not going to take years and years and years to rebuild, because if people are excited to travel and South Africa is an exciting destination to come to, well, then boom, it could rebound. So there's people being hired again. That's already happening. Those people who can do their jobs remotely and can provide services globally are seeing that already. I mean, look at the rand is strengthening on the back of industries like banking and telecoms and mining and commodities and so on. So, I think a green uphill spike is available to us economically in the last quarter of this year and most definitely sometime next year. But it's not yet. And there's still a way to go. So look, that was probably longer than I intended. I was aiming at about 15 minutes. I think I've gone a little bit longer than that. If there's information that you think I should have, so if you think I've made a mistake in this video, if you think that there is something I've mischaracterized, or maybe something I haven't touched on, or maybe there's a question you'd like to ask me that I can answer in a follow-up video, please make contact with me. Let me put that a little bit bigger on your screen so that you can see it. Please make contact with me. Send me the information you'd like me to look at. Send me your questions you'd like me to answer. And if you or your organization would like our team at Tomorrow Today Global to help you think through what the next few months will look like, to help you think about what has to happen as you get back to the office, to help you to think about how you should respond to disruption, be more responsive to change, or to just do what I've done here for your team, to give you an update on what we see for the next few weeks, months, and maybe the next into next year. Well, contact us. And we would be more than happy as a team. I would be more than happy to come and chat to you and to just help you engage with disruptive change and prepare for whatever the future holds for us. So keep yourself safe, hang in there. We will get through this, but we're not done yet. And I hope this has been useful. I'd love to get your feedback either way. Thank you.